How are Medicare Part D drug costs calculated in the coverage gap? Imagine you're filling a bucket with water, and each time you buy your prescription drugs, some of that water is added to the bucket. The way your costs add up in the coverage gap is a bit like that. Medicare Part D helps pay for prescription drugs, but there are different phases where your costs change. One of the trickiest parts used to be the coverage gap, often called the donut hole. That's when your costs suddenly jump higher. But recent changes are making this easier to understand and less costly for you. Here's how it used to work. During the initial coverage phase, you paid a small copayment or coinsurance, and your plan paid the rest. Once your total drug costs hit a certain limit, you entered the coverage gap. In this phase, you paid a larger share of the costs. For brand-name drugs, manufacturers gave a discount, which was usually 70% of the price. That meant you paid 25%, and the plan paid 5%. For generic drugs, the plan covered about 75%, and you paid 25%. The calculation of your drug costs in this gap was based on the total negotiated price of the drug, which includes what the manufacturer and the plan pay. The manufacturer discount was subtracted from the total cost, reducing what you owed. The discount was calculated as 70% of the drug's price, and this amount was credited toward your out-of-pocket costs. The plan's share was 5%, and you paid 25%. But starting in 2025, the coverage gap will be phased out. Instead of paying more during this phase, you will pay a consistent 25% of the drug costs from the start of your initial coverage all the way through the previous gap. This means your costs will be more predictable and easier to plan for. The goal is to make prescription drug costs less stressful and more straightforward. Additionally, the maximum out-of-pocket amount you will pay in a year will decrease to $2,000. Once you reach this limit, you will only pay small co-payments or co-insurance for your drugs. This change shifts more responsibility to drug manufacturers and insurance plans, reducing the financial burden on you. In summary, the way your drug costs are calculated in the coverage gap has changed significantly. It used to involve complex discounts and shared costs, but now it is designed to be simpler and fairer. You will pay a steady 25% of your drug costs, no matter what phase you're in, making it easier to understand and plan for your medication expenses.